So we're talking about the Vital Psoas, which is the name of an amazing book, and about the psoas and the iliacus, our hip flexors. So whether you're super active or whether you sit all day, which really is most of us because we have to commute to work in a car, we're sitting, our psoas either gets short and tight from being sedentary or short and tight from being super active. We're always in this position. So often, as a physical therapist, I see so many patients that come in with complaints of lower back pain, and really I'll go straight to the psoas as the source, and within a couple of sessions before we've even gotten near the back, their back pain is already starting to relieve. The psoas comes out of the spine, crosses over and attaches onto the femur, the lesser trochanter. Right here, the iliacus, which sits in this crest here, comes over, also shares a common tendon attachment at the lesser trochanter, and we call this together collectively the iliopsoas, attaching at the lesser trochanter on the hip and their hip flexors. I view this as a very valuable exercise to do with every single one of my Pilates clients that walks in the door, and it feels so good. So each lunge, I'm going to be concerned with my standing leg, taking it on the hips, squaring the hips, knee, drop the plumb line down over to the shoelaces. My arm bones are turning out, shoulders sliding down, pushing the floor away, concave abs in and out. And I'm going to push. I'm going to activate through my glutes, and I'm going to keep the hip in extension, keeping it flat here, not allowing the knee to come forward. Engaging my glutes and my abs to actually distract the joint, pull it apart instead of just sinking in, which I can do, and going back and forth. Feeling such a nice, deep hip stretch, very deep. And after I've done about 10 of these, I'm actually going to lift my back knee up, and now I'm going to allow my knee to come forward into hip flexion to engage the glutes. So the whole point of following a hip flexor stretch with a hip extensor action is because they're force couples. They're force couples around the joint with different vectors of pull. So if I stretch my hip flexors, I now want to activate my hip extensors so that they will, in essence, help maintain the stretch that I just performed.